As always, it's my pleasure to talk with you a little bit about the health status of Tennessee. And as I've done in the past, I'm going to base it on America's health rankings that have come out now for the last 32 years. And what they do is they take a whole variety of different metrics. In the early years, they were taking 25 to 30. Now they use 53 different measures in 5 categories: social economic factors, physical environment, behavior, clinical care, and health outcomes. And then they rank all 50 states, and this year Tennessee ranks, unfortunately, 44th, the 7th least healthy state in the nation by these rankings. And if you follow the America's Health Rankings from 1990 to the present, we've averaged 44th where we are right now. I want to be quick to point out, though, that doesn't mean we're not getting better, right? We could be getting better in some statistics, but other states are getting better at the same time. There are some areas where Tennessee is doing very well. We are in the top half for 10 of the 53 measures, notably high school graduation, where we're 6th in the country. And I do want to point out that in 2005, Tennessee was 49th for high school graduation. And this is a tremendous recognition of what leadership and commitment, both by elected officials and by some foundations in the state, have done. Unfortunately, there are also 17 metrics where we're in the bottom 10, and I'd be happy to address any questions that you have about these later on. The challenge for me in thinking about how we use these 53 metrics, as you can see, most of our metrics are in the bottom half, obviously. But the challenge is when you have so many metrics and you rank 13th for physical environment, 40th for behavior, 40th for clinical, 43rd for socioeconomic, and 44th overall, that's really just too much to deal with, right? No one rationally can say this is how we're going to address 53 different challenges in the state. And so I'm a fairly simplistic person, and so instead of looking at those metrics, I look at something else, which is life expectancy. Life expectancy in public health is sort of the most basic measure. It's how long we're going to live, and all of those 53 metrics play into that, and Tennessee still ranks 44th there. And if you compare America's health rankings across the bottom with life expectancy, you see there's a very strong relationship, and there's Tennessee. And if you ask me how do we address all 53 metrics, I couldn't answer that. But if you ask me what do we need to do to improve life expectancy, I can tell you what I think we need to do as a state. And specifically, I think we need to do 3 things. Obviously, we need to make sure people have access to health care. That's obvious. We need to change behavior, especially related to smoking, diet, and exercise. But we also need to provide jobs and education. And oftentimes when I, as a public health dean, talk about jobs and education, people say, well, gee, why is that related to health? So let's look at where we are in each of these. In terms of primary care physicians, Tennessee actually does pretty well. We're in the top half, which is one of the relatively few metrics where we do reasonably well like that. But what we see also is that many people in Tennessee can't afford health care. So even though we have the providers, it's unaffordable to many of the folks, especially in the poorer counties. But we see we're low on dental care and mental health providers. I'm a little bit worried about our immunization rates. It used to be higher. Tennessee used to be much higher than 33rd. So, I mean, it goes without saying, and this is what you all do every day, is work on how do we get health care to folks in Tennessee. So I'm not going to talk much about that. In terms of behaviors, if you look at America's health rankings, you can see that there's none that we do very well in. Physical inactivity, we're 43rd. Sexually transmitted diseases, 43rd. Teen births, 44. But the 2 that worry me most are here at the bottom: e-cigarette use and smoking. If you look at smoking for all 50 states, Tennessee is the 3rd worst state in the nation with a rate that's 1/3 higher. The problem for us is that a smoker will on average live 10 to 13 years less than a non-smoker. If we're that much worse than the rest of the country in terms of smoking, we're always going to have a lower life expectancy. So one of the challenges we have to have is how do we educate young folks not to start smoking. The vast majority of people who start smoking start before the age of 18. As David Kessler once said, it's a pediatric disease. So that's important. I'm not going to talk about obesity and drug use as well. Those are the other things I think we have to worry about in the state. But in terms of jobs and education, Tennessee is doing pretty well in education, as I mentioned. We're top 10 for high school graduation, and disparity, meaning the difference between white and black high school graduation, is not as great here as it is in other places. But what worries me a little bit is if you look at bachelor degree or higher, Tennessee's not as bad here as we are in some other areas. But when you think about what it takes to recruit high-paying, high-tech jobs to the state, everybody wants to have educated employees. And so I know all my colleagues at the other universities have been highlighted today, and my colleagues at ETSU will tell you we're more than happy to work with you all on any ideas that we might have on how we can get more kids through both high school and postgraduate education. And one of the reasons I care about that as a public health person is if you look at how long people are going to live based on their educational level, from both white and black men and women, you can see you can see what the life expectancy is. There's about a 3-year difference between black and white Americans. But if you compare that to college graduates, there's this huge variation. In fact, about a 5-year difference for women and a 7 to 8 year difference for men. Now, this isn't causal, as Senator Hensley has pointed out in the past, but it's a strong relationship. And obviously, if we want to improve health, we need to improve our educational outcomes in the state. And the other area is jobs, and particularly poverty. If you look at rates of poverty across the country, again, we're not as bad here as we are in some other areas. But again, when someone's in poverty, they need more support from the state. They need more opportunities, and it also cuts back on the ability to bring in jobs. And the reason I care about that, again, if you look at the chance of dying before the age of 65, a wealthy American has a relative risk of what we'll call 1. A poor American is 3.5 times more likely to die before the age of 65. So when you have an area like Tennessee with more people who are living in poverty, again, our life expectancy is not going to be that long. Obviously, there's a lot more information here, but at the end of the day, these are the things I think we need to do to improve life expectancy in our state. And the one thing I'll add to this is over the years, we've come to realize that these are inseparable. To be successful in improving health in Tennessee, we have to have all of these. You think about when you try to bring in a new employer, they will tell you they need a healthy, educated, drug-free workforce. All of these play together. And that's really where I think we need to go as a state, is to recognize that no one of these by themselves is going to change our health status. But if we work together across all sectors, elected officials, higher ed, others, we really can make a difference. And Senator, Mr. Chairman, I'm going to stop at this point, and if happy to address